Welcome to Science Force, where science comes alive.
Hello, everyone, and a very warm welcome to today's Explainer. Today, we're shining a bright light on a truly invisible, silent villain, one that has literally stalked humanity for centuries. Now, for the medical students joining us, that deep purple gram-positive stain of the tetanus bacterium is already a huge clue to its nature. But for all of us, the reality is that this microscopic organism lives right beneath our feet, just waiting for the absolute perfect opportunity to strike the human nervous system. So let's decode exactly how it works, from the dirt on the ground all the way to the severe muscle spasms it causes. Right, let's dive straight in. We've mapped out a complete clinical journey for you today. First, we're going to meet the drumstick bacterium, then we'll uncover how the infection actually happens. Next, we'll examine the deadly tetanospasmin toxin before exploring the severe clinical spasms it triggers. And finally, we'll look at how modern medicine fights back and how we can shield our future through the power of prevention. So, part 1, let's meet this drumstick bacterium and unmask the spore. Okay, we're talking about Clostridium tetani. Now, for the life science and medical students watching, yes, it's a gram-positive, rod-shaped bacillus, but what does that actually mean for the rest of us? Well, gram-positive simply means it has a very thick, sturdy cell wall. But anaerobic, that is the truly crucial word here. It means this organism thrives in environments where there is little to absolutely no oxygen. So to survive in the harsh, oxygen-rich outside world, it forms spores. Think of these spores as tiny, heavily armored seeds, just sleeping and waiting for the right conditions. So you might be wondering, where exactly are these armored seeds hiding? Well, they're literally everywhere. They absolutely thrive in soil, dust, and dirt, especially out in farm environments that are rich in animal manure. And what's really fascinating is that when the bacterium forms that protective spore, it develops at just one end of the cell. It causes the cell to swell up on one side, making it look exactly like a little drumstick or maybe a tiny tennis racket under the microscope. It's a rather quirky but incredibly dangerous little shape. Moving on to part 2, how the infection actually happens. Let's look at how it breaches our defenses. We absolutely have to bust a massive myth right away. If I ask you what causes tetanus, you'd probably immediately shout a rusty nail, right? But here's the thing, the rust itself is completely innocent. The clinical reality is that an old nail lying outside is covered in dirt and soil, and it's that soil resting on the metal that contains those dangerous Clostridium tetani spores. The nail is simply acting as the perfect, sharp delivery vehicle to push that contaminated soil deep under your skin. But listen, a nail is definitely not the only gateway. Any break in the skin can let these spores in. We're talking deep puncture wounds, everyday garden splinters, thorn injuries, burns, and even animal bites. But we must also highlight one of the most critical global risks, unsterile umbilical cord cutting. This causes what we call neonatal tetanus. It's a truly tragic and severe health risk for newborn babies in areas with limited medical care, where the spores manage to enter the freshly cut umbilical stump. Once those spores are pushed inside the body, a rapid biological cascade kicks off. Step 1, the spores find themselves deep inside a wound. And remember how we said they are anaerobic? Well, deep inside a wound, the oxygen levels are extremely low. This is exactly what they want. Step 2, that lack of oxygen acts like an alarm clock, signaling the sleeping spores to wake up and germinate into active bacteria. Step 3, they start multiplying rapidly in your tissue. Step 4, the active bacteria begin manufacturing their ultimate weapon, a devastating neurotoxin called tetanospasm. Which brings us nicely to part 3, the deadly tetanospasm toxin and how it hijacks the nervous system. It is absolutely vital to understand this next point. The Clostridium tetani bacteria themselves, they don't actually cause the main symptoms of tetanus. No, the true danger is tetanospasm. This is quite literally one of the most powerful neurotoxins known to science. Once it's produced in the wound, it enters your nearby nerves and physically travels up the nervous system pathway, going directly into the spinal cord and the brain. To really grasp this, think of your nervous system like a car. In a healthy, normal system, you have inhibitory neurotransmitters, chemicals called GABA and glycine. They act just like the brakes on your muscles, stopping them from contracting excessively. But during a tetanus infection, tetanospasm actively blocks the release of that GABA and glycine. It essentially cuts the brake lines of your entire nervous system. With zero brakes, you get continuous, unstoppable electrical signals firing straight into your muscles. All right, part 4, lockjaw and severe spasms. Let's look at the terrifying clinical manifestations of having no physiological brakes. You see, there is a silent ticking clock once those spores enter the wound on day 0. It takes time for the spores to wake up, multiply, and for that toxin to travel all the way to the brain. The very earliest you might see symptoms is around 3 days. However, the average incubation period is about 8 days of waiting before disaster finally strikes. And in some rare cases, it can actually take up to 21 days for the late onset symptoms to appear. When the symptoms do finally hit, the very first muscles to be affected are usually right there in the face and jaw, resulting in a condition clinically known as trismus. Because the jaw muscles go into this persistent, incredibly painful spasm, the patient finds it nearly impossible to open their mouth or chew their food. The jaw becomes completely locked. And that, of course, is exactly why the disease earned its famous, terrifying nickname, lockjaw. But it certainly doesn't stop at the jaw. The spasms spread through the other facial muscles, producing a highly characteristic yet deeply unsettling clinical sign known as rhesus sardonicus. This translates to a sardonic smile. The unchecked nerve stimulation forces the patient's eyebrows to shoot up and their face into extreme stiffness, creating this fixed, rigid grin that they simply cannot control. As the toxin spreads even further down the spinal cord, it triggers opisthotonus. This happens when the incredibly powerful muscles of the back and neck contract continuously. The tension is so extreme that the patient's entire body arches backward violently, bent like a drawn bow. And what is truly terrifying here is that because the nervous system is so dangerously hyperactive, even the mildest stimuli, a sudden noise, a bright light, or just a gentle touch can trigger these brutal, sometimes bone-breaking, generalized spasms. Eventually, the toxin reaches the muscles involved in breathing. If it causes respiratory muscle spasms, the patient simply cannot pull air into their lungs, leading directly to respiratory failure. It's completely fatal without intervention. So the high-stakes question we have to ask is, how on earth do we stop it before it's too late? That brings us to Part 5, Fighting and Treating Tetanus, the Medical Rescue. Survival requires incredibly aggressive, multi-step clinical intervention. First things first, the wound must be thoroughly cleaned, a surgical process called debridement to physically remove dead tissue and any remaining spores. The crucial strategy here is this: we must neutralize the weapon and kill the factory, so we give tetanus immunoglobulin, or TIG, which is packed with antibodies that bind and neutralize any of the toxin that's still circulating in the blood. Alongside that, we hit them with antibiotics like metronidazole to actively kill the multiplying bacteria. Finally, the patient needs heavy sedatives and muscle relaxants, almost always requiring full ICU admission and mechanical ventilation, basically breathing for them until their exhausted nervous system can slowly recover. And finally, Part 6, the power of prevention and shielding the future. The most critical point to understand about tetanus is that it's completely unique because it's not contagious. It does not spread from person to person. Our only enemy here is the environment itself. Therefore, our absolute best shield is the immunization strategy. We use vaccines containing tetanus toxoid, which is an inactivated, totally safe version of the toxin. This brilliantly trains our immune system to build protective antibodies in advance. Babies and children receive the DTaP vaccine. Teenagers get the Tdap booster. But here's the absolutely essential rule for all adults. Your immunity fades over time. You must get an adult booster dose every 10 years to stay fully protected. Which brings us to our final thought for today's explainer. As we've seen, those little drumstick spores of Clostridium tetani will always live in the soil beneath our feet. We simply cannot eradicate them from the earth. So, bringing it all back to our car analogy, when was the last time you checked if your biological brakes were protected? If it's been more than 10 years since your last booster, well, it might just be time to schedule a quick visit to your clinic.
Thank you for watching Science Force.